Hey everyone, Matt here. Wanted to notify you of something I just found out. I did not know about this, but a new drug to treat essential tremor. The first one designed to treat essential tremor in like decades. It is called, hopefully I pronounce this right, Ulixacaltamide, formerly known as Prax 944. The FDA has not approved it yet, and it is in the last stages of federal review process. Hopefully by January 29th, 2027, it should be approved. Sounds pretty promising. I'm not sure how effective it'll be. As effective it'll be than DBS, but I'm imagining it'll be way more effective than the current drugs. Propranolol actually is the only FDA approved drug for essential tremor, but then you have all these other drugs that can help, like gabapentin, primidone, benzodiazepines, etc. But I have a video here of Dr. Farmer of Drexel University of College Medicine, and she shares the top-line phase 3 results from the study of ulixacaltamide of the treatment of essential tremor. She highlights the promising results showing the drug's potential to effectively target the underlying pathophysiology of essential tremor with good tolerability. So, and this interview took place at the American Academy of Neurology, the annual meeting in Chicago. And this is from 2 weeks ago. So, how I found out about this drug was in a Facebook group. So I had no idea that it even existed up until now. But here you go. If you're a little nervous in getting DBS, it appears that there is going to be a new drug on the market. So let's check out the interview.
Essential 3 Study 2 was one of 2 studies conducted in parallel through Praxis Pharmaceuticals. And what was interesting about these studies is that they were a decentralized study, meaning that there was no brick and mortar site for the patients. The patients were seen in their home with a study nurse that went out to the house and then evaluated by investigators through a telemedicine visit at the same time as the nurse being there. It was unique in that we had participants from all over the country, all 50 states, and we had about 200,000 patients self-register out of interest for the study, which goes to show the need for a treatment for essential tremor in the United States. And of those 200,000 patients, through inclusion criteria and rigorous evaluation, they were whittled down to about 698 patients. Those 698 patients were then consented to both studies. They didn't know if they were going to be enrolled in study 1 or study 2. They were randomized in a 2-to-1 fashion. And then in study 1, it was your typical study. They had a placebo and drug, and they were just followed over the course of 14 weeks. Study 2 was the same study essentially from the first 8 weeks, except everyone received the drug. And then at the 8-week mark, they were randomized in either continuing on study drug or withdrawing from study drug. And the main focus was looking to see if their symptoms returned as the study drug was removed. And the symptoms did, so it met its endpoint. I think it has a huge potential for impact. And the reason is, in the United States, we only have one FDA-approved medication for essential tremor, and it's not even a neurological medication. It's borrowed from cardiology. It's a beta blocker called Propranolol. And we do treat with other things, but all of those other things are borrowed from other aspects of neurology. There's anti-seizure medicines and anti-headache medicines and neuropathic pain medicines that we try to use for essential tremor treatment. And unfortunately, patients don't stick with our current treatments available because efficacy is lacking and tolerability is also a problem. Side effects of, making people feel dizzy, lightheaded, cognitively, medicine heady sort of a thing. So this is the first drug that is really looking at the pathophysiology behind essential tremor, and it's focusing centrally in the brain on the circuit that drives tremor. And it's blocking the receptors in the brain that drive the tremor, hoping to sort of reset the circuit so that there's less tremor and smoother movement wherever the tremor happens to be on the body: head, arms, legs, neck, that sort of thing. So since there's nothing readily available, to have something that is pharmacologically, mechanistically appropriate that has been shown to be effective is very exciting. It's also been shown to be well tolerated in the studies, so it has the potential for very strong clinical utility.
Wow. Intriguing. So the advancements of science and medicine right before our very eyes. So I dug a little bit deeper, and the percentage of tremor reduction, it says here, was 54%. I'm sorry, a 48% reduction in tremor impact on the daily lives of these patients. So, I don't know. I mean, will this be better than the medications that are used now? Maybe. Can this be used in tandem with DBS? Maybe your DBS is only getting you so far and you need a little bump. But, I mean, that's pretty promising. A drug specifically for essential tremor. Like she was saying, propranolol is a a hard drug. And then, like your gabapentin. I mean, that's the issue I had, is the sedation. I did not like the sedation effects of these other drugs. So I'm glad maybe this will replace a lot of those other drugs in effectively treating tremor to a higher level. But I don't know, if I know a lot of my viewers have DBS or are going to get DBS. Would you be willing to try this if it gave you a little more of a relief, depending on where you're at? Maybe you don't like the slurry speech that the DBS gives you. So maybe this is like a boost for you. Or maybe, like I said earlier, it's just too risky in your mind to get DBS, or you don't want to sit there and on a neurosurgeon's operating room table and be awake while they're fiddling around with your brain. And you would like to go the medication route. So this is great. And who knows, I'm guessing there's going to be even more and more drugs to treat this. Pretty promising. We're living in a pretty awesome, progressive world with advancements of science and medicine and technology. Sky's the limit for humanity. Pretty exciting stuff. But anyways, leave some comments. I'd love to hear what you have to say. Like and subscribe. And good luck to you in your journey. I'll see you next time. Thanks for watching.